Taoiseach, last week I raised the issue of where patients with PNH, a life-threatening blood disease, were being denied access to Soliris, a life-saving medicine. 35% of those with the condition die within 5 years, and the life expectancy without treatment is that. So it's a very, very serious situation. And back in 2010, 10 patients by the then government and HSE were put on treatment in St James's Hospital. But since then, new patients have been denied this therapy and this treatment, which is used in the United Kingdom and indeed across Europe. And Taoiseach, I've met some of those involved, spoke to Mary Gorman, to John Duggan, and I think Mary Gorman's letter and indeed testimony is very heartrending indeed. And I would contrast it with a young woman who had to emigrate to get to treatment. And Mary Gorman talks in terms of, I am slowly dying with this disease. And she talks about how her daily life, another dreadful night of disturbed sleep and distress. It's a daily onslaught on my body. And this is a 2-year battle she's had with the authorities, and she's been writing to you for the guts of over 12 months, Taoiseach, as well. She had a job, she was energetic, she now has no job. And basically, I'm slowly but surely dying without treatment. And she ends her letter by saying, I hope the government, the Minister for Health and the people responsible in the HSE are fully aware of the distress and utter devastation they are causing. And you contrast that then, Taoiseach, with a young woman who I've also spoken to, who at a young age, in her 30s, developed this particular condition and was diagnosed with it, and was denied treatment in St James's Hospital. Wasn't told why she was denied it, and was given no time frame in terms of when she might expect to get medication. So in 2013, that young woman went to another EU country, and before she was resident in that country, she was able to talk to the haematologist, who reassured her she would get the treatment. And within 5 days of going to that country, she was on the treatment. And the contrast in her life is as follows. I am now very fortunate that I can now work in an extremely high-pressured environment with very long working hours without the worry of treatment and PNH over me. And poignantly, she says, I will never be in a position to return to Ireland so long as Soliris is unavailable to me. So she's permanently in exile. And we have the case, of course, of young Maeve McGill from Ardra in Donegal, a 15-year-old denied the treatment, whose family have been farming in that area since the 1800s and who are now planning to sell their small farm to go to the United Kingdom so that she can get access to the treatment. Now, Taoiseach, I would put it to you, have you any shame at all? And has the government any shame that a situation like this is carrying on for the last 2 years?
Thank you.
When you know that this drug has been available in the United Kingdom, it's an orphan drug with a limited market. You also know that there has been little proper engagement by the authorities, from what I can read, in terms of offers and so on like that. And Mary Gorman was denied all freedom of information requests in terms of times, venues and meetings between the company and the HSE. Why? What's the big secret?
Thank you.
In terms of times and venues. It's a disgrace, Taoiseach, and I would ask you to urgently intervene to make sure that patients get access to this particular drug therapy.
Taoiseach.
This is a very personal issue, and I take on board fully what you have said in respect of the person involved here and the letters that are written. I'm dealing with a case came to my attention the other day, who's gone to the United States for a particular form of treatment also. I don't accept from you that the Minister or the HSE or the government aren't aware of the importance of the sensitivity of this. I pointed out to you last week the cost here is €400,000 per annum. You can't put a price on a life, I understand that. The HSE has been engaging very deliberately with Alexion and Pharma, who are the company who produced the drug here. I'm disappointed that they haven't been able to reach a conclusion that the company would make the drug available at a cheaper cost and at a lower price for people who need it here in Ireland. I have to say that's very regrettable, and I'm sorry that the distress that this is causing to this patient and other patients, small in number but very sensitive, who have to put up with the scale of these challenges. I have to say that it's important to stress that the engagement of the HSE with Alexion and Pharma is designed to bring about a situation where you can have this drug available at a more reasonable cost and therefore be able to treat more people. Deputy Martin is well aware of the scale of the challenge facing the health services. The HSE will continue to engage deliberately with the pharmaceutical company, urging it to provide this drug at a more reasonable cost. I don't know the country you're talking about or the nature of whether it's the same drug that's required abroad or not, but this is an indication, Deputy, of why we have to move towards a position of having a universal health insurance where access to medicine and attention that's required can be available to people as they need it. You may shake your head. You were through this yourself with very sensitive cases, and I understand exactly what you're pointing out about the person involved, and you can be, righteously indignant if you want from your party's point of view. This is about an engagement here between the Health Service Executive, the Department of Health and Alexion Pharma. They're charging $400,000 a year for this drug. There are 10 people at the moment on a pilot scheme in the country. I would wish that the company would be more reasonable in their response to an engagement here when they know that there are small numbers of people with this very challenging condition here in the country. We'll continue to engage directly with them, Deputy Martin. I don't know the number of meetings that took place, but I can find out for you.
More than you're saying. Yeah. Because 9 months ago, you wrote to Mary Gorman, enclosing an email from Laverna McGuinness from the HSE. And the offer 9 months ago was $125,000, which is a 65% discount on the current price. And nothing since. I would argue that's not a realistic offer. You're playing hardball with people's lives. There's a UK precedent, and NICE in the UK, that's the National Institute, they are not known to be particularly generous in terms of approving new drug therapies. And over 200 patients in the UK are getting this. I can't name the country because I have to protect the identity of the person who spoke to me. Very anxious, and that's understandable. But it's an EU country, similar to our own. It has nothing to do with universal health insurance, Taoiseach. It's about willpower. It's about a desire to get to the bottom of something and get it sorted. Because in 2010, 10 patients, and it was under the high-tech drugs programme in St. James's Hospital, clinician-led by Dr. Paul Brown in that, and it was identified that was going to be the national centre that would deal with this. And it was specifically said in the agreement, which I've read, that it was not going to be administered under the community drug pharmacy scheme. It was a high-tech.
Thank you.
And there's been a long history in the country of providing access to high-tech drug therapies, particularly new emerging pioneering drugs, where it could significantly improve quality of life and indeed allow people to live a normal life. Taoiseach, you just said, in terms of your response, in terms of no one can put a price on life. You have put a price on life here. I've spoken to Mary Gorman again this morning. She is in deep distress in terms of her medical condition, and time is running out, Taoiseach. And I spoke to John Duggan last week, a young married man. And does that young girl at 15 and her family have to uproot themselves from Donegal and go to the United Kingdom? Because they will get it in the United Kingdom.
Thank you.
And just think of that woman, in 5 days having left the country, got access to it like that. Just like that, under the public system now, in that particular country.
Taoiseach.
See Mary Gorman and the other people involved here, John Duggan, being able to be treated with this drug. Situation, as I said to you, is that Alexion Pharma are charging $400,000 per annum for this. The engagement here is to see can that price be reduced. You make the point about the email previous times. Now, 10 million has been invested here, as you're aware, for a number of people who are on a programme with where you can actually plot the progress and the benefits of treatment of the drug for this particular category. So I'm disappointed that Alexion and Pharma have not reached a decision to be able to allow for the treatment of these patients more quickly and at a more reasonable cost. We'll continue to engage with them. In fact, I'll take the opportunity, if you give me the telephone number of the good lady involved, to call her myself.
Thank you.